Okay, we are going to begin our meeting for the KCRHA. I want to recognize right now we have some punctual board members here, but do not have our quorum yet. So we're just going to do some preliminary stuff without the quorum that I think the rules should allow us to do, at least to have some informal discussions. And once we have a quorum, I'll recognize that we do have a quorum in case anyone wants to challenge any actions that were taken without a quorum. Or I don't think how they could just challenge conversations when there's no actual action. So having said that, my name is uh, Mayor Harrell. I'm chair of the board, and I call the December meeting of the King County Regional Homelessness Authority's governing board to order. And I want to thank the Seattle Public Library for hosting the in-person location today. I also want to begin, as we always do, with our theory of change. We begin every meeting by grounding ourselves in our theory of change, which states, if we create a homelessness response system that centers people with lived experience of homelessness, then we will be able to respond to the needs and eliminate inequities in order to end homelessness for all. And then we like to follow that up with our land acknowledgement. And here is our land acknowledgement. We acknowledge that King County is located on the unceded traditional land of the Coast Salish peoples. We honor this land and its people, past and present, and we are committed to directing funding and resources to organizations led by and in support of Native and Indigenous people. And having said that, will you please call the roll?
Yes, Chair. Uh, Member Savali is absent. Member Barone,
Here.
Member Balducci, Member Aviva, Member Aviva,
Here.
Member Nelson is on her way. Chair Harrell,
Here.
Member Juarez, Member Bracken. Bracken is here. Member Bernie.
I'm present. Sorry, crying baby.
Member Bernie.
Here.
Member Prince.
Here.
Member Backus.
Here.
Member Hay.
Here.
Chair, we have 8 members and Member Nelson is on her way, you've been told.
Thank you. And we have 8 members, and 9 is our quorum number. So we need 1 more at this point. Is that correct?
Correct.
Okay. So I won't approve the consent agenda without a quorum. I believe I would need a quorum for that. Why don't I just say a few things, and then I'll turn it over for the CEO updates from Dr. Kelly Kinnison. So to take a little liberty here, this will be my last meeting attended, and I want to thank board member Aviva and board member Backus for very kind to say some favorable things about my participation. And I just wanted to say I'm not trying to I really don't want any more comments because that becomes a little embarrassing at some point. But I would like to say it's just been my honor to serve all of you fine people really committed to this issue. And the work is still here, which means I'll still be around a phone call away from anyone, whether it's staff or elected officials or community members, anyone that wants to engage on what really is the crisis of our lifetime in terms of homelessness and make sure people are sheltered and getting services to make sure they can get on with their lives. So it's been absolutely my honor. And having said that, just to sort of walk through the plan on today after Dr. Kinnison gives her report, that we will likely have a vote when we have the quorum on the 5-year plan update. The discussions about regional funding and services analysis, that's just a discussion item. And I would hope that these discussions continue when I think we're all committed to a regional model, but we really need to then say what that looks like, what that means in terms of policy, adoption, and funding strategies. And it's not an adversarial conversation by any stretch of the imagination. It's just a collaborative discussion. So we'll just have some of that continue today and questions and answers. The vote on Resolution 2025-13, which is the budget, unless there's a strong objection and people really want to vote on that, if I had my druthers, we wouldn't vote on that. So I wasn't going to call for a vote. I would just think that either some successors on this board may want to have that discussion. But if I'll sort of defer to the group if they want to have that kind of vote. In preparation for this meeting, I just asked the question, should this board in December make that vote on the budget for next year? Might it make sense to delay that until the next meeting? So I'm just giving people notice that um, I'll defer to the group, but I just had that listed as a possible vote, not a vote. And then on the resolution on the governing board schedule, of course, we could be able to vote that because that could always be amended down the road. So that's just sort of plan, and we'll go into executive session before all of those discussions. And okay, so having said that, I won't approve the consent agenda, but I think the rules can allow Dr. Kennison to simply give an update to those that are on the call. So Dr. Kennison, may I turn it over to you to give an update?
Thank you, Chair Harrell. It has been a transformative year for KCRHA. Under this board's leadership and our co-chair's leadership, we've accomplished a great deal of work. We are excited to share a document with that outlined for you towards the end of the month. Because of you all, we're better positioned to fulfill our mission as the regional response system backbone, which I know Mayor Harrell is calling on us to go further and get into the policy discussion around that. Just thank you, Mayor Harrell, Mayor Bernie, others of you who may be cycling off the board for all of the work and your leadership and your questions and your driving us toward action. As we pivot to onboarding new board members, we do hope to continue to have your support and advice, but we know deeply that your commitment to the mission will carry forward into the future. So a couple of updates for you all that I know folks are waiting to hear. First, on our federal funding. As everyone is aware, we had a notice of funding announcement for 2025 from the Housing and Urban Development Department, our federal funding. That was withdrawn just as court proceedings were about to begin in the lawsuit that King County and many others are party to. We did learn yesterday in court proceedings that HUD's legal counsel told the judge in that case that the revised notice of funding announcement may come out as early as Friday or within the next few days. KCRHA is ready. We've continued to prepare and continue to work with providers and potential applicants to prepare with workshops discussing the different housing models that are eligible for HUD funding this round, requirements for data and coordinated entry, and really just encouraging them to continue preparing because we know that the timing for this notice of funding announcement is part of the strategy the administration is using to put these funds out. Our preliminary injunction hearing is December 19th, so tomorrow. And we will continue to keep the governing board and all of our community partners updated via our website, our blog, emails, all of the many convenings that we are doing with partners and providers. In other COC news, the COC board has been continuing to work very hard to support this work. There was a wonderful meeting on November 18th, one of our annual convenings in person, where 121 community members, providers, behavioral health partners, and system leaders across the region came together to really have a pause and think about homelessness in our region, how we focus on accountability and systems level change. There were a number of sessions that were really well attended, lots of COC board members present, as well as folks with lived experience, KCRHA staff, elected officials, and it was a really productive day and great way to end the year with some momentum in how we work together in 2026. We are recruiting for the Continuum of Care Board. We have 6 open board positions. Filling these positions gets us more points on our Continuum of Care application for the federal funding, but it's also really important to make sure we have the right representative expertise from the community, which is what the COC board is intended to bring. The open seats are for elected officials, law enforcement, and a business leader. So 3 elected officials, 2 law enforcement representatives, and 1 business leader. So we've been doing outreach, would love your recommendations or your assistance doing outreach to folks you think would be good. The deadline for receiving the short application is the end of this month, December 30th. And then the COC board has a process for vetting and selecting new members. Moving on to our 2026 PIT planning. It is that time again where we do our biannual point in time count, which is our best way of estimating the number of folks who are unsheltered in our region. This is conducted by federal mandate and state law, and KCRHA is the coordinator of this effort. Planning happens with a COC point in time count committee, community work group. They've been working very hard the last several months to line up all of the systems and volunteers and technology that needs to be in place, in addition to our partnership with the University of Washington and our many city and county partners that provide infrastructure support, such as locations to do this work from. So this data collection happens January 26th through February 6th. We would love to have more volunteers, so folks can reach out to KCRHA to look at our website and figure out how to volunteer very prominently on our website right now. We also have a lot of information coming to folks who are interested in the methodology and how this is collected in more detail on our website. So happy to provide more on that in January as we get closer, or can direct folks to our website to get all of those details. And now I will turn it back to you, Chair Harrell, and the board for any questions.
Thank you, Dr. Kinnison. Are there any questions of Dr. Kinnison on her monthly report? I'll wait to see if I see any hands. Not hearing any or seeing any questions. Thank you very much, Dr. Kinnison, for your report, and good luck on your point in time count. And hopefully we'll get a lot of volunteers helping out. Okay, so I believe we could still take Afyang, I'm going to call on you or Lisa to tell me we could take public comment, where I think,
Yes.
without the quorum. So let me say a few things about public comment. If you are here with us in person, please sign up to comment. If you're providing comment via Zoom, please raise your hand now and you will be called in the order received to the best of my ability. Each commenter will be able to speak for 2 minutes, and commenters will hear a bell when they have 30 seconds left, and virtual commenters will be muted when their time is up. Public comment will be open for 15 minutes or until no others would like to speak, whichever is sooner. We do ask that public commenters to keep your comments related to items within the board's purview. And Afyang, having said that, will you please open public comment and we'll proceed.
Yes, Chair, we have no in-person commenters, but we have 1 virtual commenter. Hallie Willis, we're starting your time. Can you check your mic? Hallie, can you check your mic?
Yeah, can you hear me?
Yes, we can hear you.
Perfect. Good morning, board members. My name is Hallie Willis, and I'm the policy manager at the Seattle-King County Coalition on Homelessness. As many of you know, our region's HUD Continuum of Care funds, particularly those that fund permanent supportive housing, are in serious trouble. If that funding is reduced, eliminated, or even delayed, we risk thousands of people, many of whom are seniors and living with disabilities, returning to the streets in 2026. Our region is leading the way to protect our community from this crisis. So far as I know, not many other communities have been able to prepare as well as we have, and we need to do more to keep people safe. I want to sincerely thank the Seattle City Council and Mayor Harrell for allocating about $21 million in contingency funds in their budget to help keep people housed. That will make a huge difference. I also want to urge King County to allocate at least another $14 million so we can keep people in their homes, even if HUD cuts our housing funds. Finally, I want to urge all the members of this board to join us in advocacy at the state level to create a contingency fund to keep people housed and safe and to fund the additional housing and shelter we desperately need. Thank you very much.
Thank you for your public comment. And I believe that will conclude. I think I want to just verify this concludes our public comments. Am I safe to close it out?
Yes, we can close out public comment, Chair.
Okay, so let's consider public comment closed. Next, we're going to move into executive session. And let me say a script to allow us to do that. We're going to move into executive session to discuss matters related to RCW 42.30.110, subsection 1.I. I'm sure everyone has that memorized. Has little to do with potential litigation, just for those that have done these executive sessions before. So as presiding officer, I'm announcing that we are slated to be in executive session for, my script says 15 minutes, but I'm going to say 20 minutes just because it takes us 5 minutes to even get on that thing. So 10:26. So I'm going to say until, let's just say 10:45. And it will be extended. If it's to be extended beyond that time, I'll announce the extension and the expected duration following the executive session. No, the meeting won't adjourn. We still have agenda items. That's my script's a little off there. So let's begin it now. And I think you should have the link in your chat. And if you don't, find someone that can give it to you. So it's in the chat now. We're good?
It's in the chat.
Yes,
Okay.
in the chat and emailed
All
as
right.
well.
Okay, and email. Okay, so I'll see you in executive session and we'll convene after. All right. Okay, Lisa, should I make my record now?
Yes.
Okay. As the chair of the KCRHA for this meeting, I'm going to extend the executive session for another 15, I'm going to say 20 minutes, I'm going to say to 11:05. And if we have to go beyond that, I'll come back into public session and extend it again. And with that, we'll move back into executive session.
Thank you.
Okay. Just one moment here. Screen right. Okay. That concludes our executive session. We're coming out of executive session. I do want to announce, I believe, Alfiona, you keep me honest on this one. I do believe we have a quorum now. Is that correct?
Yes, Chair.
Okay. So why don't I go back to the beginning of the agenda where we can approve the consent agenda. So our first item of business is our consent agenda. We have one item on the consent agenda approving the October 25th, October 2025 meeting minutes. Is there a motion to approve these items?
So moved. This is Board Member Bernie.
Is there a second?
Second, Backus.
Okay, it's been moved and seconded that we approve the consent agenda. All those in favor say aye.
Aye. Aye.
All those opposed? I believe the ayes have it. We've already had the CEO report, so we're going to move to the first agenda item, which is a briefing on number 2025-08, the regional funding and service analysis. I'm going to ask that we try to be very concise in our presentation because our executive session went way beyond the scheduled time. Please proceed.
Thank you, Chair. I'm going to turn it over to our Associate Deputy for Strategy, William Towie, to kick us off.
Thank you very much. And you'll see the slides coming up here. I'm pleased to be presenting to the governing board the slide deck that was, I believe, first presented a meeting or two ago. Next slide, please. And I will endeavor to move quickly through the material for everyone. The question of regionalism is central to the King County Regional Homelessness Authority, of course, and I think these questions are excellent questions relative to that. And the first three questions really kind of knit together well in thinking about the questions. You know, do we have the right services in the right place? And in 2026, we're prioritizing the continued delivery of a core services baseline that's available to all unsheltered people in King County, regardless of their location. And that service, that core services level, needs to be able to address the true diversity of the population that we're serving, that really has a lot of diversity, from ultra low income seniors and those with disabilities, through general pop sort of people with workforce preparedness issues, maybe income issues, and of course behavioral health and substance use disorder type issues. And in terms of the distribution, that gets informed because while we have a core services level in mind, different regions will have needs for different levels of service and different particular areas of focus. The question around local service delivery is also important because while homelessness obviously is a national problem, and it shows up in certain metro areas with a real intensity. Seattle, King County is one of those metro areas that's deeply impacted, as we all know. But while it is this sort of national problem, it is experienced very locally, and that's both by the people who are themselves unsheltered as well as the community who are experiencing that reality amongst their space. And So those three things all fit together, and our ability to have a regional approach that makes sure we have a baseline, but also brings the right other services at the right places is important. The next question around resource sharing and the roadmap is equally important because funding and land are two of the main key components to the delivery of interventions of any type within our system. And I think we're all familiar with that. We have a shortage of both, and accessing either funding and the places to put projects is a key part of the opportunity. With regard to policy coordination, I think, again, from a regional perspective, I think we're all on the same page at a very high level about the kind of outcomes in our policy and wanting to really understand how we can better serve these individuals who are suffering so deeply in our midst. But again, from a regional perspective, there are distinct differences in how different parts of the county are experiencing this and the policies that they may have in place for those. Next slide, please. This is a key question in how the public funding works. One of the things that's not often clear is that when the money arrives at KCRHA, 96% of it is already completely and entirely spoken for. We have no fungibility around those funds. They arrive to us already aligned with a specific vendor, a specific contract, and a specific function. The opportunity for KCRHA to perform its role in this regional effort is by participating in the early budget planning process. And we are better positioned than we have been in the past as we go into 2026 in that regard to help inform how the county and the city think about their choices relative to the deployment of those funds, which programs are really giving us the most impact, and how are we being the best possible stewards of those funds relative to the overall system response. Next slide, please. Our sub-regional approach really speaks to this in the sense that we want to have this core services baseline that's undergirded by data. We have a really strong data system here. We have a lot of data at KCRHA, and we're really at the point now where we're beginning to be able to integrate that to drive accountability around the programming and the funding in terms of its application to interventions that are most likely to yield the results that we seek. We also are driving a collective and collaborative system that seeks to connect with the cross-sector partners that are really important in the landscape. And then obviously we want to have community engagement and participation because, fundamentally, as Mayor Harrell noted, this is the problem of our times, and everyone in our community has a role to play in the outcomes that we're seeking here. Next slide, please. The analysis and progress around regionalism and the work that we do does center in data to some degree, and the next few slides really lean into that a little bit. We have the mapping layers. Some of you were at a recent open house. We're seeing some of the tools that are going to be launched to the public soon, which really allow us to put the inventory of service response public, to have it linked to maps, and to start getting real-time integration with all of the providers through HMIS up into those dashboards. Our first point in time was completed a couple of years ago. The second one that we're doing, actually it's the third, but this next year's point in time will be really an important moment for the system. We're going to have a deeper ability to provide more collection sites for the data, and we're excited about how that will more deeply inform important attributes relative to regionalism. And we really want to try and find out where we have opportunities, where we have gaps, where we can improve within the regions and the overall service system. Next slide, please. This is a slide that whoops, sorry, one more, please. Can we advance the slides to, I think, 13? Thank you. This slide was delivered previously. It is a slide that basically discusses precarity and the likelihood of people becoming unsheltered. And again, you can see there's some hot zones that are centrally, you know, the metro area is where most of the action is in this landscape, of course, but we see the South King County region where there's really a deep impact. And of course, we're all familiar with the disproportionate impact that these problems have for our communities of color and for people in poverty. And next slide, please. This slide again notes the distribution of, I'm just going to move this here, of income, people in poverty. And again, the metro areas of Seattle Metro, South King County are twice the rate of poverty than the other areas. And again, that's where we expect to see most of the intensity. Next slide, please. Here we see that graphically in comparison with the precarity data and the point in time count. And again, you'll see the Seattle metro area is the darkest with 56% up in there. And then you see how that difference is well highlighted here in terms of precarity and outcomes and the disproportionate impact, the higher rates of eviction between the East County and the South, with a large difference there. I would note the North County numbers. As you can see on the map there, it's a very small geography. It's also very tight to that North Seattle area where we believe there's sort of crossover in some of the numbers there. And we're excited to see what our 2026 PIT reveals about that in more detail. Next slide, please. Here we see against the housing inventory count. The housing inventory count is basically all of the shelters and beds. You can think of it like, what are the numbers of beds that we have within our system response? And here we're seeing, you know, the point in time count versus where the resources are deployed in terms of having response. And again, you can see the deepest impact is in the metro area and the South County area. And that shows up in both of these lenses of looking at it, although, you know, the shortfall of services is notable in the South County area, and the centralization of services in the metro area is also notable in comparison there. Next slide. This slide offers, again, another way of kind of looking at that, and some important things to note here. Basically, this 9,500 in the first column, and then, you know, over 7,000 in the second column. When we talk about our PIT count reaching 16,000, that's where this comes from. So when we talk about people who are, you know, unsheltered, we're really talking about people who are without any kind of housing or home. And they are either on the streets, in this case approaching 10,000 people, or in shelter beds of some type, which is 7,000 people. We do have two other main areas of where beds are provided, three really. We've got the transitional programs, we have the rapid rehousing dollars, which allow people to get sheltered through the system, as well as the permanent supportive housing. So next slide, please. And again, this is just, you know, showing out by the regions, the different ways of assessing that. You'll again see the Seattle metro area has the by far the highest number of homeless people per 10,000. And, you know, it combines unsheltered and sheltered. It's kind of counterintuitive, but people who are in shelters are homeless, unsheltered people, even though they're in a shelter. It's a nuance of the inside baseball to some degree. Next slide, please. And I think this is really a compelling slide to consider, because while the total column adds up, you know, the columns, it doesn't bring them all together. What this slide is really sharing with you is that our homelessness response system in King County has about 20,000 beds, in essence, in one way or another, that are being used to address our homelessness response. We have 10,000 people out on the street. we have another 20,000 who are in some sort of bed, one way or another. We are engaging with 50,000 or more people every year. So every year, the homelessness response system is engaging with over 50,000 people. Every year, we're getting about currently 18 to 20,000 new entries into the homeless management information system that are coming in every year. And the dilemma, the raw dilemma that we're facing is we're getting 20,000 people every year, and our unsheltered count on the streets is going up by 1,500 to 2,000. So when you look at the historic trend of the pit counts, they're going up. Every time we do one, we're up another couple of thousand. And what that shows is that we're having a really robust system response, but we aren't getting 100%. And when you're dealing with the scope and scale of these problems at population scale, even when you're missing 5 or 10%, it is deeply impactful. And of course, the reality is that the 5 or 10% of that response every year who are ending up increasing the numbers of unsheltered people on our streets tend to be the most vulnerable, the most challenging, and the most underserved relative to the causes and conditions that they're experiencing, which is why permanent supportive housing is such an important pathway. It also speaks to the need for integration and improvement with cross-sector systems like behavioral health, medical, and other systems. Next slide, please. This is an interesting slide. I would note that the baseline on this is from the 2021 countywide Growth Management Act planning stuff. It's another way of demonstrating that we need more. We kind of know that already, though, I think. I'm hoping that we'll get an updated kind of projection on this in 2026. Next slide. And again, this is very, very big picture stuff. And this is talking about housing. And, I think that's one of those interesting things when we talk about cross-sector engagement. The homelessness response system is one sector. Housing is another sector. Behavioral health is another sector. And we've got to continue to find ways to make these work more closely together with a particular focus on how we serve those really challenging cases that the system is not able to respond to well at the moment. Next slide. This is where I would pass it off to my colleague Tiffany Brooks, who handles all of our finances here.
Hello, everyone. As I get started with the next few slides, I want to highlight that these funds that we are presenting to you with the regional approach is showing how the KCRHA administers funding that we receive throughout the King County region and the sub-regions. I want to also highlight that we will be working with the different jurisdictions to identify the funding that they have available and are expending and administering within their particular region and servicing homelessness, as well as the different housing approaches that William just mentioned as well, such as rapid rehousing, permanent supportive housing, homelessness services for shelter services, and so on and so forth. As you will notice from this chart that we do receive majority of our funding from the city of Seattle, and $104 million is directed to providers for homelessness services. Those services range from rapid rehousing, shelter services, PSH, which is permanent supportive housing, transitional housing, diversion, as well as safe lots and tiny house villages. King County is our next largest funder at 23%, and $42 million goes directly to providers for the funds that we receive here at the KCRHA. We do receive funding from North King County and East King County through ILAs. Our North King County ILA supports several agencies so that they can provide some services in their regions. And then for our East King County ILA, which is fairly new, provides severe weather services for those two particular regions. We have funding from the Department of Commerce, which is about 11% of our funding, and $17.6 million of those funds goes directly to providers. We're providing our encampment resolution project. And then we have our COC HUD funding for COC care, and we receive about $18.3 million that goes directly to providers for transitional housing, rapid rehousing, and some other services that we provide to specific populations with those dollars. Next slide, please. The following slides are going to break down our funding by each of these regions, showing where the majority of the funds for that region is going, program type. So for our Seattle metro area, the majority of the dollars are, of course, going towards shelter services with $99.3 million of it. These dollars are not exclusive to funding that we receive from the city of Seattle. It is funds that we receive from all of our funders that are being directed to this particular region. And so as you'll see from the chart, we have 64% that is coming directly from the city of Seattle, 7% from HUD, 16.5% from King County, and 11.4% from the Department of Commerce. I do want to highlight that within the breakdown of funding by program over to the right, where it's identifying the amount of funding that we're receiving for each of those program types, due to the nature of us not wanting to bombard you guys with a lot of too much information on this slide, we did roll up some of the other program types that are not some of our major program types into other programs. And I've provided a breakdown of what's included in other programs in the footnotes. Next. For our East King County funding, you will notice that majority of the funding, 79% of those funds, are coming from King County, with the next largest amount being from the city of Seattle. I do want to notate that for some of these dollars that are received from the city of Seattle and from some of our other funders, it's basing some of these items based off of where the services are, the type of service that is being provided. So even though some of the services may be provided outside of the city of Seattle, it's for providers who could be providing scattered site services where a participant may be housed outside of the city of Seattle but received their initial services within the city of Seattle. And then, of course, we are focusing on a countywide approach when we have our King County dollars. And so you will see that those dollars will sprinkle across the different regions within King County. Next slide. For our North King County dollars, majority of these dollars, which is 84.5%, is coming from King County. And then we have some scatter site models as well that are being funded by the city of Seattle. And of course, the majority of our North King County dollars from our ILA are also funding our North King County projects. Next slide. Similar to what I previously stated, for South King County, it's the same. Majority of the funds that we receive for South King County are coming from King County, which is 64.8%, with majority of those funds going toward shelter services. We do want to acknowledge that we do have like RAP services, which are regional access points that we have that service people throughout the region. And so you'll see some of these RAP contracts that are attributed to South King County as a region, but then you'll also see them on the next slide where they're going toward region-wide services, so that we are providing services to everyone throughout King County. Next slide. And for this last slide, I believe it's for our countywide services. So these are funds that we're receiving from multiple funders, but it's also providing services throughout King County. Some of these are attributed to some outliers where their home base is within the city of Seattle or within one of the other metro regions. However, they're providing services throughout the county to scattered site projects, as well as rapid rehousing, transitional housing, and other diversion, preventative, and outreach services that they may be providing. Next slide. And I will send it back over to William to finish up the presentation.
Thank you, Tiffany. I just want to do a little and check in where we're at here. I've been seeing some messages that we're needing to move quickly, and happy to do so. Just wanted to check on that.
How long when are you going to be finished? How many more minutes do you need?
Whatever number of minutes you want me to move. I'll move as quickly as possible. How about that?
Okay.
Okay, next slide, please. Some of the regional challenges we're facing are as expected. We have a lack of resources and we're struggling to understand how to ramp up the response that we need. And another area here regionally is the distribution of services. How can we make sure, as I mentioned earlier, that we have a core services baseline across the county and the right mix of investments and responses? Next slide. Other considerations when looking at subregions center on the transportation, whether or not there are specialized responses. For example, our crisis care centers are a great response. They're expensive, and we're rolling out 4 or 5 of them in community, but we can't have one in every single community, of course. And then there are differences in the way an intervention would be deployed, obviously smaller, less dense shelters in some areas. Next slide, please. When we think about regional opportunities, we know that we have good partnerships in place. We have strong collaboration and engagement. We've seen that this year, and in fact, a good example of how KCRHA is influencing the funding response is the fact that we have 4 seasonal winter shelter programs in place. A big critique over the years was that the severe weather response of kind of turning on, turning off, turning on, turning off was not as effective, and that seasonal winter shelters are a better investment. They drive better outcomes, and they link into the fact that ultimately every investment we make in this system should be tied to housing outcomes in a meaningful way. Next slide. Next slide. We will continue to be doing our sub-regional planning. We have strong relationships out in the various communities. We have a strong participation in their local activities and groups. So, North King County has a homelessness coalition. Other regions have their own localized responses, and we participate equally with them. We are seeking, through the budgetary process I outlined earlier, to really begin influencing and informing and doing our part in what really is a tri-party funding budget development process. Next slide. There we go. At this time, we'd welcome any discussion or questions.
Okay, we do have 3 agenda items we need to move on to, but I don't want to prevent anyone from having any questions or points they'd like to make, and I will try to look at the screen and see if there are any hands going up. Dr. Kinnison, is your hand up?
Thank you, Chair. I just wanted to note that this is really a baseline for us that the team has put together, and we have a number of analyses already going on to look at different aspects of this, dig a little deeper into funding that is happening region-wide, not just administered by KCRHA, and looking at where the regional analysis needs to be to support the decision makers. So more to come. This is sort of just some level setting that we're really proud to be able to share with you.
Thank you, Dr. Kinnison. Board Member Bracken?
I just really quickly wanted to commend you on this. I do love the idea that these seasonal shelters, instead of opening and closing, can maybe be a springboard into a more permanent housing solution for these people. So hats off to you there. And then I think my only real question I have is, there was a breakdown of the different housing classifications in one of the slides, and there was a difference between transitional, permanent, supportive, shelter, and I believe rapid rehousing. And what is transitional housing classified as in this instance?
Thank you for the question, Board Member Bracken. Definitely appreciate that. And distinction between transitional housing is that it's programmatically centered in the sense that permanent supportive housing, we understand what that is. Rapid rehousing is vouchers where we are really just doing a financial assistance offering for a person. Shelter beds are emergency shelter, we understand that. Transitional beds are where they're linked to a specific programmatic intervention or outcome. A commonly understood one would be perhaps substance use treatment at a longer term.
Okay, great. And so clean and sober housing would maybe fall under that as well. Maybe people living in like a mental health court bed. I know that Weld has those within their organization. Okay, thank you for the clarification. I just wanted to make sure that I understood.
Thank you, Board Member Brecken. Any other questions or comments? Let's see, I'll scroll and toggle. See, I don't see any or hear any. With that, I'll just close out by saying that, Dr. Kinnison, I appreciate your point. This is, we sort of have to force the issue that I don't think any jurisdiction, any city, or even the county have failed in their, what they said they would do, or failed in their commitment toward the issue of homelessness. I think they all are doing the best and have lived up to the agreements they've made. I think moving forward, because the crisis continues, that we're going to have to force ourselves to define what regional really looks like. Do we have common policies? Can we have common policies in our county, and investment strategies, or chip in any way we can to address the issue? So good discussion. I'm going to move on to
One question.
Okay.
This is not a question, it's a statement. I am eagerly awaiting what has been termed the rebid, the rethinking of how we distribute services and resources. It has been established that shelter is a good way of bringing people, of dealing with homelessness and our growing unsheltered numbers, as was mentioned earlier in the presentation. I have not seen that. I don't know when it's coming out. My term on this board is concluding. I want it just noted for the record that we do have to do this. We are building housing in some areas more than other areas. People are coming here. That means our counts are going up, and there is still no contemplation about whether or not we should make a change in the mix of housing types that we are investing in to better address the continually increasing numbers that are coming into these areas that have disproportionate housing and homelessness. People come where they have a better chance of getting housing, and also where certain policies are different as to ability to occupy public spaces. And so without that frank conversation and those understandings, I see the continuation of the status quo in terms of imbalances that were mentioned in this presentation. That's just what I wanted to put on the table. I hope that will continue. That will be an effort going forward. So thanks.
Okie dokie. Okay, so we're going to, are there any other comments? I'll ask again. I try to close it when I ask that. Are there any other comments before I move to the next agenda item? Nope. Okay. I did have a request to go to the resolution 2025-13, which is the budget. And what I did say in my opening remarks for those that were late, that I wasn't pushing on a vote for the budget only because we might be all better served to have the new board make that decision. But if people want to convince others to do it a different way and get the vote out, they can make their case. But why don't I stop there and have staff present Resolution 2025-13, which is a resolution to confirm and approve the 2026 proposed budget. We're joined by Interim Chief Business Officer Tiffany Brooks, who will be presenting the budget. Go ahead, Tiffany.
Thank you, Chair. I'm just going to jump in at the top and address your the timing issue. Very much appreciate that folks are seeing this month after many months of working on this together in this format. We do hope to have, from KCRHA's perspective, an approved budget going into the end of the year, beginning of next year. The ILA states it needs to be approved by the end of January, and we believe that with the reassignments in January and other transitions, it may be very difficult to have a quorum meeting in January. So this may be the opportunity outside of a special meeting, if that were possible, to go into the approved budget and meet the ILA requirements. This is the budget that folks have seen, the budget numbers that folks have seen, and comes to us basically from the city county, is put together in a document for you all after all of your hard work in wearing your other hats as city executive officials and elected officials. And as stated before, we are coalescing it and presenting it to you. Based on that, there aren't changes initiated by KCRHA. And over to Tiffany.
Thank you. Can you confirm that you can see my presentation?
Yes.
Thank you. As Kelly stated, yes, we are presenting our budget based off of the adopted budgets from the City of Seattle and King County and the funding that we currently have under contract with HUD and our other funders. The timeline that we encountered over the course of this year for our 2026 budget started earlier in the year, where we presented our proposed budget, preliminary budget, based off of guidance that we received from our funders. We then went through different iterations with our funders to provide more information, as well as modify the budget to adapt it to what's realistic of what we would be receiving as an agency within the KCRHA, as well as putting into some considerations of what our fiscal impacts and federal executive orders and impacts of those orders would be as well. We have then followed the budgets very closely between the city and the county as it worked through the executive and mayor's office and then through their respective councils. And now we have worked with both the city and the county to finalize what we anticipate to come to the KCRHA and have put that together in collaboration with their teams to put our budget together for 2026. And we will then soon be rolling into 2027, where, as mentioned in the previous presentation, we will be working with the city and the county so that we can better align our budget process with theirs so that we are in alignment with those budget proposals in time so that we can effectively get them through in a timely manner and in alignment with their budget schedules. The funding that we are anticipating to receive in 2026, where we're seeking budget approval, is for $205 million total. We are anticipating $118.9 million from the City of Seattle, which is subject to change based off of federal impacts for COC funding, as well as King County for $44.3 million, North King County for $278,000, East King County for $45,000, which is subject to change into 2026 after we've finalized and closed out 2025 spending, and our carry forward is modified and moved forward into 2026 with whatever funds left unspent. For our HUD funding, we anticipate we have under contract rather $25.3 million. I want to notate that you'll see in the next slides that for our HUD funding, that these are dollars that we currently have under contract with HUD. It is not taking into consideration anything that is in the process of going through the NOFO process or the NOFO process that's been rescinded and is anticipated to be re-released at any time. For our Department of Commerce, $15.9 million is under contract with the Department of Commerce for our encampment resolution project. And then we have $150,000 in philanthropic funding that we receive. Our funding broken down by our funders, as well as the different fund sources that we receive from our funders, is broken out here. We wanted to provide this to you so you could see the different colors of funding that we receive and how we manage these dollars according to the different compliance requirements that we have for each of these fund sources. And of that, we received $124 million in local fund sources, $47 million in state fund source, and $34 million in federal fund sources. The majority of our funding comes from the city of Seattle with $118 million, approximately 58%, King County at 22%, the HUD funding coming at 12%, and Commerce at 8%, and then our other funders do come up to just under 1% for each of them. Our funding by program type, of course, majority of our funds will be in shelter services, and it ranges all the way through to severe weather, where that is the lowest amount of funding that we receive due to it being seasonal and just triggered by different events by nature. Our funding comparison year over year between 2025 and 2026. 2025, we had an approved budget of $206 million. 2026, we have $205 million for our budget. I do want to highlight some of the high level changes that you would notice on here. For diversion services, we have a contract that we typically go through a process and add it to our budget later in the year after our budget is approved, once we identify existing resources to cover that project. And so it's been added to our budget from the beginning of the year for 2026. So you'll see that difference there. In our shelter services, you'll see a difference in funding where we have some one-time funds that were allocated to us in 2025 that will not continue into 2026. And you also will have some funding that we received in 2025 for the standing up or relocation of projects, which are also one-time funds in nature. You will also notice a change in some of our rapid rehousing and transitional housing, where some of those dollars are just fluctuations in funding by our funders due to some contracts that will either be sunsetted or reallocated to different agencies, or gone through a NOFO process for bonus dollars where it might have shifted from one project type to another project type. I'm sorry, is there a question?
I don't think so. I think someone just had their speaker on. Keep going, Tiffany.
All right, thank you. For our City of Seattle funds, it does include a 2.6% inflationary increase as well as a 2% wage increase. We want to thank you guys for increasing those contracts for agencies as well as the wage increase for agencies. And you will see the breakdown of each of our funding by program type as well from the City of Seattle for a total of $118 million. We do want to highlight some budget actions that took place for 2026. Not all budget actions will come to the KCRHA, but we do want to highlight them for our board so that you're aware of them due to their nature and its potential impacts to homelessness services. For these, we are identifying the ones that will be identified and administered by the KCRHA, which are the first two bullet points, which is runaway and homeless youth supports for $1.4 million. And then we also have a statement of legislative intent that it requests for us to work with HSD on KCRHA's administrative funding shortfall. For budget actions that will be administered by the City of Seattle, there's a neighborhood engagement and mitigation plans. This is $80,000 in general funds for a consultant to convene providers and create a framework. Sorry, I'm trying to go very quickly because I know we're out of time, so please forgive me. And this is for a framework for projects for a specific neighborhood engagement and mitigation plan. We also want to recognize that the City of Seattle did put in place a $20.4 million reserve, as mentioned by one of our board members earlier, and we definitely want to thank the City of Seattle and associated council members for all of your hard work to ensure that we are providing services and trying to continue services that will be impacted by federal funding. And so the breakdown of the $20.4 million is $11.1 million. It's broken out by $7.8 million for startup costs for operating and standing up a new shelter, either 2 or 3 new shelters for approximately 307 new shelter beds. That's on hold for the first quarter or first half of the year until federal funds have been hashed out with the federal government. And then $3.3 million of investments from a $4 million investment for a one-time community solutions initiative, where $700,000 will still go toward the agency and $3.3 million will be on reserve for federal funding. And then finally, $9.3 million is on reserve for HSD to mitigate federal funding impacts. In addition to that, we have a budget action for the City of Seattle that will be administered by the City of Seattle, and it is the Neighborhood Engagement and Mitigation Plans. And it was mentioned in the previous slide, but it's still in here as well as a separate to identify that it will not be administered by the KCRHA, but it will be administered by the City of Seattle. For our King County funding, as we did for the City of Seattle, we're breaking down our funding from King County by fund source, as well as program type, so that we could see the breakdowns of how our funding comes to the KCRHA and how it will be distributed to agencies for the services that they provide. And we want to thank King County for providing an inflationary increase as well to our providers. I believe that inflationary increase that we're providing is 3.6 or 3.7%. And some of the budget actions that we have from King County, and again, not all of these will transition to the KCRHA to be administered by us, but we do want to bring it to your attention due to its impacts to homelessness services. The first one is for shelter and housing investments, where we have $5 million to keep the Soto shelter open through 2027. I do want to highlight that this is through May 2027, and that is when that lease is expected to end. And so we just want to highlight that it's not for the full year of 2027. We will continue to work with our funders to identify if there will or will not be funding to continue that program, but we do want to acknowledge and recognize that this is through May 2027 that they will have funding available to them. We also have $3 million for 80 new shelter beds in Federal Way and $3 million to support family, youth, and young adults facing housing insecurities. There's an additional council add for shelter and renewal supports. We have a $3.2 million for Kenmore and Reclaim Shelters for 3 new tiny home villages and youth providers, and then $3 million for rental assistance. In addition to that, we also wanted to bring to your attention the health and behavioral health protections for $31 million, for hospital tax to safeguard healthcare services from federal cuts, as well as $8 million in contingency funds for behavioral health. And then they also have the continuum of care support that is potential funding to strengthen COC programs with existing resources. However, that dollar amount is not identified, and this is not yet something that has been confirmed that will or will not happen. Other fund sources are our North King County, East King County ILAs, philanthropic funding, HUD, and our Department of Commerce for the Encampment Resolution Program. As mentioned earlier, for our East King County, these are for severe weather funds, and it's a new ILA that we stood up late this year. And then for HUD, And then for HUD funding, these are for contracts that are currently under contract and have been executed between the KCRHA and HUD. KCRHA operating and admin dollars are approximately 7% for 2026. I do want to highlight that the KCRHA will continue to work with our partners according to the slide through City of Seattle to identify and monitor our administrative shortfall. We do have an anticipated shortfall for our admin funding in 2026 for just under $1 million. And to ensure that we got closer to being within budget, we did undergo several reductions and budget balancing activities in 2025, late 2025, to address the budget shortfall. The impacts of the budget shortfall is that we did have significant agency-wide budget and staffing reductions to help close that shortfall. We also will anticipate having major delays in long-term initiatives for our Salesforce system integrations and compliance automations. And then we are also postponing the customer relationship management project that we were anticipating to have through Salesforce unless funds and resources do become available to support it. Again, we're just sharing the overall budget for 2026, so it's readily available for any discussion items, and we can refer back to any other slides if you have any questions. Oh, sorry, we have one more, which is our 2024 accountability audit results. We were going to have the Washington State auditors come into this meeting to go over our audit results, but due to so many items being on our agenda, it didn't seem feasible to have them present to you guys. But we do want to highlight that For this year, when we had our audit, I'm going to quote from the auditors: in most of the areas that they examined, the KCRHA operations complied in all material respects with applicable state laws, regulations, and in its own policies, and provided adequate controls over safeguarding public resources. We are very proud to have a clean audit and for us to have only one finding within our accountability audit where it is tied to our funding model, which you guys are already aware of. We presented on that earlier this year. And so that did continue into this year, which we were anticipating. And the audit did cover the following areas, which are financial conditions, financial model, rental assistant programs, new software implementation for Salesforce from Flux, and open public meetings. And our next audit is scheduled to start in the summer of 2026. And we are looking forward to having our next audit and hopefully a clean audit as well. That is the end of my presentation.
Thank you, Ms. Brooks. And you're one of the few people that I know that are looking forward to an audit. Okay. I had said during my remarks, first of all, are there any questions of Ms. Brooks or anyone else that shared the budget presentation? Any questions? Look for some names. I see Board Member Barone.
Thank you, Mayor. Tiffany, thank you for the presentation. I think one thing that I wanted to just, I think you covered in your remarks, but I wanted to make sure that we made it clear to the community who might be looking at some of the comparisons between the 25 and the 26 proposed budget. One of the kind of significant numbers that people might see there is a decrease. I would call it significant decrease in the amount that's allocated to enhanced shelter. Could you talk a little bit about that and specifically just what I think you mentioned that there are some one-time costs that are associated there. Does that represent any kind of loss of capacity? Could you talk about what that means? And it seems to be like we're not deciding that as a board here. It's more we're kind of implementing decisions that have been made through by other funders. Is that a fair assessment?
Yes, that is a fair assessment. And I would say for the decrease in funding that you're seeing within shelter services is not a decrease in shelter units for the dollar amount that you're seeing. It is a decrease in funding where we had some one-time funding allocated to the KCRHA in 2025 for a few relocations, as well as standing up a new project. I believe it was the Star Center, and you will see that we had some one-time funding shifting where it is no longer carrying forward into 2026 because those funds are either no longer needed or they will have to go through a carry forward process if they're still needed for some of those relocations or project stand up.
Thank you.
Thank you, Board Member Barone. Are there any other questions or comments? I'll give it a second. Not seeing any hands go up. I had said during my initial remarks that I wasn't calling on a vote, although this was presented as a vote for in the form of a resolution, given the fact that we're going to have pretty much a new board next year. I do understand the point Dr. Kinnison made, and staff members probably believe that, of course, they always want a budget approved to have some that behind them as they get to work. I believe we've actually lost we needed a 2/3 votes on the board. I believe we lost a quorum anyway. So I think sort of a mood issue is where we can't vote. So unless someone corrects me, I'm going to move to the next agenda item, I think, which again, we would have voted on, but I don't think we'll even vote on that. So not seeing anyone raising their hand, why don't we go to the next agenda item, which is resolution 2025-12, which is the 5-year plan update.
Thank you. Afyang, are you going to run the slides for me?
Yes, I will, Monica.
I'll just go ahead and get started since we're so short on time. My name is Monica Irons. I'm the Director of Planning and Special Projects at KCRHA, and I appreciate your time today to present the addendum to the 5-year plan that we're asking you to approve. I understand that you don't have quorum, so you may not be able to actually approve it today, but I'm happy to bring it before you. Next slide. I want to talk about why we're doing this addendum to our 5-year plan. Basically, in the fall of 2023, KCRHA released its strategic plan, and there was a ton of community engagement around that. The governing board voted for it, the implementation board voted for it. So it was kind of set, and it was set until 2028. About a year later, the State Department of Commerce released its state plan for housing and homelessness. And in this state plan, they updated the requirements for all the local plans across the state. So if we wanted to continue to get state money, we had to bring our plan into compliance with the state's plan. We did a crosswalk starting last November to see exactly what we needed to do to bring our plan into compliance. And then we built a team, and the team included City of Seattle HSD members, King County DCHS members, and then KCRHA staff. And we met regularly, worked really hard to get all the data elements together that we needed for our addendum, and wrote the addendum. We spent this summer and fall doing a lot of targeted engagement with key stakeholders. This also was a requirement from the state that we add to the addendum. And we were hoping that today we would get adoption of the addendum because it is due to the state at the end of the month. Next slide. So the state requirements that we are required to get in accordance with are, number one, they wanted our planning period to be the same as the state's. So that's 2025 to 2029. Our planning period from our 5-year plan was 2024 to 2028. So we're changing the time period that the plan is good for. They wanted us to align our strategies with the state plan objectives. Our 5-year plan has about 80 strategies in it. The state plan had 5 objectives, and I'll show you what those are. So we had to align our 80 strategies with the state plan's 5 objectives, doing a crosswalk. They also wanted us to really dig deep and get some data. So they wanted an estimate of service levels across King County. This is both HMIS reported service levels, like was chatted about by William, but also non-HMIS programs. So where are we, what types of shelter, transitional housing, permanent supportive housing. They also wanted a survey of all the fund sources for homeless housing assistance programs and capital projects in King County. So we put together a table with all this information. We really relied on our King County partners to help us with this. They also wanted an estimate of permanent and emergency housing needs. And this is something that William presented in his talk, but we used the growth management comprehensive plan that King County has put together to come up with these estimates. And then finally, they wanted an outline of the prioritization criteria for our capital projects. KCRHA really doesn't do much capital projects. So in this case, we worked very closely with the King County Housing Finance Program, the City of Seattle Office of Housing, as well as ARCH and SKIP to look at all those prioritization criteria that they use, and we included that in the addendum. Next slide. As part of the requirements by the state, we had to do a bunch of targeted engagement, and we did that basically in the summer and fall. That's all here. Next slide. The objectives, go ahead, next slide, Afyang. The objectives that the state is requiring us to align with are promote an equitable, accountable, and transparent homeless crisis response system. Number 2, strengthen the homeless provider workforce. Number 3, prioritize those with the greatest barriers to housing stability. Number 4, prevent episodes of homelessness. And then number 5, seek to house everyone in a stable setting. And when we really worked hard looking at our five-year plan and the 80 objectives, we found that they crosswalked very well with these 5 objectives. And as part of our plan, we have in an appendix a crosswalk of all our 80 objectives to these 5 objectives. Next slide. We added a 6th objective. The state gave us leeway to add a 6th, and this is to build and reinforce regionalism. As William talked about, strengthening our service delivery and coordination across our subregions is a very important tenet for KCRHA. Next slide. As part of the requirements by the state, we have to track our progress. We are using these 5 metrics, which are the metrics that our data and planning team, our data and research team already report to the governing board annually. And these have to be will have to be sent to the Department of Commerce annually as well. Next slide. We did include a link to the draft addendum of the plan in this PowerPoint. Unfortunately, that link isn't completely updated, so I did want to give a chance to kind of, if anybody had any questions. We did not include some of the appendices because we were still working on the community outreach components of this plan when we thought we were going to present it in October. So I'm happy to answer any questions about the parts that aren't complete in that link, and we'll make sure to provide you all with the actual 5-year plan addendum as it's written now. Any questions?
Any questions for Ms. Irons? Thank you very much for the presentation. I'll wait for a minute. We're not going to vote given the lack of a quorum, but I want to make sure give you an opportunity to ask any questions. I'm not seeing any hands. Oh, Board Member Barone.
Thank you, Mayor. Well, I just wanted to just Monica, because you mentioned that this was expected by the end of the month by the state. Do we understand any consequences by our failing to act this month?
Actually, we've already sent them an email suggesting we might not have it, and they have said that that would be fine.
Okay, thank you.
Yeah.
Thanks for asking that, Board Member. I was going to ask the same question. Any other questions? Not seeing any. I'll move to the last agenda item, I believe, which is the schedule for next year. Again, why don't you just present it? We're not going to vote on it, but we can at least take a look at it for those board members that will continue for next year.
Certainly, Chair. So this last resolution 2025-14, is just for the board to approve the for the 2026 meeting schedule. As the resolution is written, we would be continuing with the cadence we had this year, which was the 3rd Thursday. However, we are flexible to changing the cadence based on the schedules of the new incoming members, and we are already aware of certain meeting conflicts that may require us to shift to a new meeting cadence. The reason why this is on the agenda is because it is part of our bylaws that we pass it at the end of every year. However, due to the fact that we no longer have quorum, we can definitely do it at the next meeting.
Very good. Thank you for that. Any questions on the schedule of meetings that Afyan presented? I imagine there wouldn't be. Okay. With that brings us to the end of our agenda. And if it's okay, I will entertain a motion to adjourn.
I don't think we can move on that.
Yeah, I
think
know.
we
I was
just have to
going to
adjourn.
say, hey, we're stuck. We got to meet all day. So everyone just get your coffee. We're going to meet all day. We can't even move to adjourn. I will tell you what we'll do in the absence of that. I will just take the executive privilege and I will adjourn the meeting. Board Member Barone, I see your hand up. Did you want to make a comment?
I just wanted to, on the record, to say to Mayor Harrell, to Councilmember Nelson, and to Mayor Burney, who are leaving us from the board, gratitude for your efforts on this board. So thank you all.
Very kind of you. Thank you very much. I appreciate that. Before I just exercise some privilege to adjourn, I want to make sure everyone is good. And for those jurisdictions experiencing these floods, my heart and prayers go out for all of you and your constituents. This is really tough stuff. So, okay, with that, everyone have a great day and thank you for your work and look forward to seeing you very soon. Talk to you later.
Thank you.